Good afternoon and welcome to the importance of jaw and airway development in children. My name is Dr. Leslie Pascoe. I am a general dentist of over 26 years. I'm an oral facial myologist, and I'm also a certified Buteyko breathing instructor. I am the founder and president of Airway Centers for Kids, which is a myofunctional therapy center that focuses on jaw and airway development for children. Today, we're going to talk about why the human jaw is shrinking and what effect it is having on our children. What does it mean for their health and their well-being now as a child, but also into their adult future? We'll talk about the signs and symptoms that you as a dentist or other healthcare provider should be looking for. And we'll talk about myofunctional therapy and how it addresses the jaw and airway developmental concerns in children. And then last but not least, we'll talk about how you can help. This is Airway Centers for Kids. This is our facility where we see kids both in person and virtually. And we have an open environment for the children, their families, but we also provide healthcare education in our conference area so that we can increase the awareness of other providers so they can make referrals and help their patients the best that they can. This is Ashley, one of our therapists, and just talking to other healthcare providers about what we do. Again, our mission is to bring awareness to the medical and dental community and other healthcare practitioners, but we also provide talks and informational sessions for families, parents, educators, individuals who are involved with children on a daily basis. The difference between our center and traditional myofunctional therapy is that we use FDA-approved devices, medical appliances that have 30 years of research backing them. These appliances are designed to increase compliance, and we get great results this way. Our programs are anywhere from 6 to 8 months long. In some cases, they may extend to 12 or longer, depending on the child's needs. And we see the child every month rather than every week to be able to improve their muscle function and continue compliance with our programs. So what do underdeveloped jaws and airways look like? Underdeveloped jaws and airways are obvious by looking at the facial structure. When we have asymmetry in the face, as you can see in this young girl here, we can see that she has trouble keeping her lips closed because her teeth are in the way, and her teeth are in the way because her jaws did not develop properly. In the last picture of this young lady, you can see the dramatic overjet that she has, which makes it difficult, not just for her to keep her lips closed, but to eat and to speak. So when we look at a little girl like this, who was a thumbsucker from birth and who was also slated to have orthodontic surgery, there's dental implications here to her jaw development, but there's also sociological and mental implications to how she's developing. And it has a lot to do with how they grow and develop as adults. This is also another little girl who has an underdeveloped jaw. You can see by looking at the picture that her jaw is too far posterior. It's retrognathic. And when the jaw grows backwards and down rather than forward and out, it not only crowds the teeth and other issues intraorally, but it also has a lot to contribute negatively to the development of that child's airway. This is also what underdeveloped jaws and airways look like in babies. And there is a correlation between poor muscle posture, weak muscle tone, and underdeveloped jaws in infants. 90% of SID deaths occur within the first 6 months of life, with the rate peaking between 1 to 4 months. So death comes suddenly and unpredictably for most parents because they don't realize that when their baby is sleeping in a position like this, that they're actually trying to breathe or establish their airway. So in most cases, the baby seems to be naturally healthy before death, but then, the baby is suffering from lack of being able to breathe. In this case here, this picture is actually a picture of a child that was struggling to breathe, and this child eventually did die and was said to have died from SIDS. So underdeveloped jaws and airways, we can see them in adults, but we see them in children and we can see them in infants as well. So the question is why is this happening? Why is this occurring in our society? And the reason is because our jaws are shrinking. And our jaws are shrinking because our genetics were designed for our caveman-like structure. If you go back 5,000 years ago, 10,000 years ago to our ancestors, they didn't have, as you could see in this picture here, they did not have underdeveloped jaws. They did not have crooked teeth. They did not have impacted third molars. In fact, they had what would be a movie star's dream smile. And that was 15,000 years or more before the movies even began. Our current society, the way we live, the foods we eat, the Industrial Revolution, the farming age, the women going back into the workplace, the lack of long-term breastfeeding, that is all contributing to the growth and development as a maladaptation in our society. Our jaws and consequently then our airways are not functioning properly because they're not growing properly. There's a great book out there called The Story of the Human Body by a biologist, an evolutionary biologist, Dan Lieberman. There's plenty of references there, not just about how our skulls and our jaw structures are growing and developing, but also overall body and how our bodies are developing as well. So this problem has been happening for a long time. It's nothing new. Generationally, we can see that the jaws from family to family are getting smaller over time. Again, if we look at the hunter-gatherer's jaw, it was growing forward, out, and up. But when we look at the jaw, the skeletal structure of the modern industrial human being, it's growing back and down. When the jaw, you can see the difference in the muscle structure as well, and how the muscles are becoming smaller and not as strong due to that issue. You can also see how that would impact the development of the teeth. Without the jaw being big enough for the teeth to come in place straight, we get crooked teeth and impacted third molars. I like to say that, if we had impacted third molars 3,000 to 5,000 years ago, we would have had difficulty surviving as a species because we just didn't have what we needed at the time to deal with infections and impacted teeth. So our race would have had much more difficulty growing and expanding if it grew and expanded at all. We may have even died out as a species. This is a great book, and I'll talk about some more reading before the end of the webinar. It's called Jaws, and it is really the story of a hidden epidemic. The root problem that we face is that truly we have entered a space age with Stone Age genetics, and our bodies are designed to grow and develop a specific way in a specific environment, but our environment has changed. So then the question is this genetic? And the answer is no. Small jaws are not genetic. It's a maladaptation to our current environment. The color of our eyes, the type of hair that we have, our general appearance, yes, that is genetic. But our jaws maladapting to our current environment is an environmental issue, not genetic. So the effect that it's having on our children in the dental profession, we see this all the time. We have the crowding teeth, we have the open teeth, we have the worn teeth, we have cross bites, over bites, under bites. You name it, we see it. Increased chance of gum disease, dental decay. We're seeing this on a regular basis. In fact, having braces as a child has become so common in our Western world that it can almost seem to be a rite of passage. Today, it's estimated that 50 to 70% of US children will wear braces before adulthood. One thing to point out here, since we're on the subject of braces, is that when the muscle function is not proper, when the tongue is not functioning properly, the lips, the cheeks, everything is not in harmony, that's where we get orthodontic relapse from. And so for orthodontic treatments to be successful longer term and to last and not need to be retreated, the muscle function needs to be under control. So what effect is it having on our children, not just through their mouths and how their teeth are developing and erupting, but what about them as an overall individual? A few staggering statistics here. 7.1 million kids and adolescents in the United States had received an ADHD diagnosis, 1 million more than the children in 2016. So the numbers are increasing. There is science that shows that children that have sleep-related breathing disorders are 40 to 100% more likely to be diagnosed with ADHD. It could be a misdiagnosis, just simply from the fact that they can't breathe. If the jaws aren't forming properly, it impacts the upper and middle third of the airway, and children who aren't breathing right are not functioning properly. 1 in 9 US kids ages 3 to 17 have gotten that ADHD diagnosis. They call it an expanding public health concern, according to the CDC. By 2020, 5.6 million kids aged 3 to 17 years old had been diagnosed with anxiety problems, and 2.4 million had been diagnosed with depression. We're talking kids 3 to 17 years old having anxiety and depression. I would like to suggest that their brains just aren't functioning properly because they're not breathing properly. If a child is mouth breathing, which is the number one concern for why the mouth is not forming properly and why the teeth are crowded, the muscles aren't functioning as they should. If a child isn't breathing properly through their nose, they're not getting the beneficial effects of breathing through their nose, but also by mouth breathing, they're telling their brain that they're in a fight or flight situation. Mouth breathing is reserved for short periods of time when an individual, when a human being is in danger. So now as a child is mouth breathing, they're telling their brain that they're in danger. Their body is under their sympathetic nervous system control. The amygdala part of the brain, the old-fashioned part of the brain, it kicks in. And it takes that energy and development away from the prefrontal cortex, which means that the child's behavior is going to be irrational. They're not going to be able to make proper decisions. That's the old-fashioned amygdala part of the brain working, and that's the part of the brain that's reserved to just get us out of a dangerous situation. It's a temporary usage. But if a child is functioning on that full time, then they're not developing their prefrontal cortex. And so I'm suggesting, and the science suggests this and proves it, that children's brains are not developing properly if they're breathing through their mouth. We're going to see more behavioral issues. It shows that the literature shows that children with breathing problems like snoring, mouth breathing, or apnea are 40 to 100 times more likely to develop behavioral problems resembling ADHD. Not necessarily ADHD, but resembling ADHD. So then the question is, how many children are being diagnosed with ADHD when they're simply just not breathing properly? Maybe because it's a habit, or maybe it's because they can't. Either way, it needs to be addressed and attended to. Reducing the size of the airway can, for instance, eventually lead to breathing problems such as sleep apnea, which itself has become a significant factor in public health. Some 20% of American adults are afflicted, and about 3% have a sufficiently serious case to cause daytime sleepiness. These are people that we're mingling with, driving next to, working with every day. But sleepiness is the least of it. As many as half of all cardiac patients suffer from this disease. Sleep apnea also appears to generate mental problems, including lower IQ, shortened attention span, and difficulties with memory. There's a list of different health issues that this is having on our children. And we know about dental problems, the facial changes that occur, the sleep disordered breathing, the high blood pressure. When you breathe through the nose, you create nitric oxide, which is known to, in a chemical known to actually help reduce high blood pressure, cardiac issues, digestive issues, chronic fatigue, infections, postural changes, anxiety, depression, hyperactivity. These are just a few of the health-related conditions associated with improper jaw growth, development, sleep apnea, and sleep-related breathing disorders. It can be corrected. This young girl that I showed you before, this photo is a courtesy of Dr. John Mew. She was intercepted early. She avoided that orthodontic surgery. She went through a combination of orthodontics and myofunctional type therapy to actually improve her growth and development, even at this age, which at this age she was between 11 and 12. So you could see her small jaw and airway before and the results after. My question is how did this impact her personal life? I would say that it impacted her personal life pretty positively. I am sure that she had more confidence. I am sure that it has led her overall to a better lifestyle, better acceptance in society as well. Here's the other young little girl, again, intervened early on and corrected with a combination of orthodontic and myofunctional therapy. Here's one of our recent graduates. His name is Jameson. This is just under 6 months of our therapy with our MRC myofunctional appliances. You can see his underdeveloped jaw, which was also contributing to his underdeveloped airway, both from his facial profile, but also from his smile. Interestingly enough, this little boy actually had early palatal expansion prior to discovering us, and we were able to improve his growth and expansion with just our appliance therapy and exercises in less than 6 months. So let's take a look at what myofunctional therapy is. It is a specialized form of treatment that is aimed at correcting the improper function of the orofacial and now the airway muscles. With our particular appliances and airway-focused exercises, we can actually improve the growth, the development, the tone, and the function of the airway as well. Myofunctional therapy focuses on the coordinated actions of the tongue, lips, cheeks, and jaw to promote optimal facial and airway development. And particularly, we'll be talking about the tongue today. Just a quick background on the evolution of myofunctional therapy. It started in the 15th century in Italy, where an independent individual recognized the influence of the oral muscles on jaw development. And it progressed, continuing on through orthodontics. Alfred Rogers actually published a book called Living Orthodontic Appliances. And what he meant by that was our muscles are actually living orthodontic appliances or treatments, and that the mouth grows and develops, the jaws grow and develop under the way that the muscles of the jaw function. In the 40s, the orthodontic profession, however, shifted towards a viewpoint that favored more genetic influences over the muscle influences of the development of malocclusion. In other words, this is where the discussion of crooked teeth are genetic, not necessarily a result of muscle function. But prior to the 40s, it was very common knowledge in orthodontics that the muscles determined how the jaws grow and how the teeth come into place. In the 70s, the term myofunctional therapy emerged, and the specific techniques were developed. In the 80s through the 90s, it gains more traction, mostly in speech therapy, but now we're seeing it assist in dentistry and orthodontics. And now, from the year 2000 to present, there has been more research that has supported the efficacy of myofunctional therapy. And now myofunctional therapy is recognized as a valuable treatment in clinical dentistry, speech therapy, and airway. So myofunctional therapy assists in all of these areas. Myofunctional therapy is used to address various conditions like mouth breathing, which we see a lot here at the center. More and more healthcare practitioners, and especially families, are becoming aware of mouth breathing as a bad habit and the different medical conditions and situations that occur when a child is habitually mouth breathing. So the reason I like to bring that up, because as a healthcare practitioner, you better know about it, because more and more parents are becoming aware and they're asking questions and they want to know, is mouth breathing bad? And the answer is yes, it is bad if it's done on a regular basis. And most children are breathing through their mouth on a regular basis. Again, mouth breathing is only reserved for the fight or flight response when you're trying to get out of danger. When a saber-toothed tiger is chasing you, that's when mouth breathing is reserved for. Mouth breathing as a regular breathing habit is actually detrimental to a child's growth, development, and health. Ankyglossia is tongue ties. We see that a lot. I do have concerns about it. Myofunctional therapy can help with the range and motion of the tongue. Sometimes we need tongue tie releases, sometimes we don't. But what we're seeing mostly is the habit of mouth breathing, improper breathing, from an obstruction or from a habit. Improper swallowing patterns, overactive swallowing, overactive muscles can impact how a jaw grows. We see a lot of that. Of course, malocclusions, how the teeth are coming in. Are they coming in crooked? Are they coming in, overlapped? Do they have impactions, congenitally missing teeth? Those are cross bites, overbites, underbites. Those are all malocclusions. Speech issues, and then also sleep apnea and other sleep-related breathing disorders. I like to point out that sleep-related breathing disorders are not just sleep apnea. There's a whole long list of them, and before we're done, we'll go over what you should be looking for in regards to that. This just shows you here what a myofunctional therapy patient looks like, what their concerns could be, where their tongue is positioned, how their face, jaw, airway, cranium is growing, what their teeth are doing, how they're coming in, straight, crooked, how they're chewing, swallowing, digesting, and how they're breathing. And all of those things are connected to different types of causes resulting in different types of symptoms. So for example, the airway, the breathing, the respiration, mouth breathing rather than nasal breathing can lead to sleeping disorders, upper airway restrictions, snoring, sleep apnea, obesity, hyperventilation syndrome. It can lead to behavioral issues, ADHD, bedwetting. These are all sleep-related breathing disorders. Chronic fatigue, anxiety, depression, stress, poor decision-making, hypertension, short tempers, poor behavior in children, children falling asleep at school, lack of good grades, lack of good behavior. These are all things that are associated. So this is to illustrate the different pathways and all the different things that are associated just from the function of the muscles and the jaws of the mouth, head, and neck. So let's talk about malocclusion or crooked teeth. Improper tongue position and muscle posture leads to improper jaw growth, which leads to underdeveloped jaws and airways. So we're going to see teeth crowding, poor dental health, impacted third molars, TMJ issues in children and carrying forth to adults. None of those problems get better on their own. They need therapy, they need intervention. Speech issues, and of course, sleep-related breathing disorders. Myofunctional therapy supports dental alignment and preventing advanced orthodontic issues, as well as improving orthodontic retention. So there's over 15 oral and facial muscles and 5 airway muscles that myofunctional therapy can target and address. And the one that we're going to be talking about today is the tongue. The tongue has many strengths and capabilities. First of all, its structure, it has intrinsic and extrinsic muscles, making it very powerful, very strong. The tongue is also very versatile in speaking, swallowing, tasting, food manipulation. How the tongue functions is very important to a child's growth and development, how they swallow and how they're manipulating food and eating. Aversions to certain types of foods that children have, usually hard, crunchy foods, is generally because they can't make their muscles function properly in order to manipulate the food so they can chew it properly, or their teeth aren't coming together properly, which doesn't allow them to chew the food correctly. That's an indicator. The tongue is also forceful. It has a reasonable amount of force that aids in the functions of how the jaws develop, but also the chewing, swallowing, and eating patterns of an individual. The tongue also, it endures. It is used continuously, and it seems to never tire. So the tongue strength really lies in its ability to be adaptable. And the tongue is something that, as an orofacial myologist, we deal with routinely. It's the tongue, the tongue, the tongue. If the tongue is not positioned properly, which we'll talk about here in a second, then we don't get good growth pattern. There are different habits that the tongue has. The tongue can thrust, it can click. Children have a habit of sucking or suckling on their tongue. Tongue chewing is another habit that we see commonly. And most importantly, what we see the most is that the tongue has an improper resting position at rest and when swallowing. Okay. Again, as a reminder, the tongue's strength lies in its adaptability. So the tongue can be easily retrained to do what it needs to do. So when we talk about proper tongue position, let's talk about where it should be and what it should be doing. At rest, when swallowing, the tip of the tongue should be just behind, the front teeth, and the rest of the tongue should be suctioned and held at the roof of the mouth. The teeth should be slightly apart, they shouldn't be touching. The lips should be closed, and the individual should be breathing through their nose. Good tongue posture can help with breathing, eating, facial structure, and yes, even anxiety. If the tongue is in the floor of the mouth and the mouth is open, you can't breathe through your nose. And breathing through the nose, as we have determined, is good for the overall body structure and the growth and development, but it's also good for long-term medical and health responses. So here's an image of the proper tongue position, A, B, C, or D. Which one do you think it is based on the proper tongue position definition? Take a look. Which one do you think it should be? If you said B, you're right. It should be the tip should be just behind the upper front teeth, and the body of the tongue should be suctioned to the roof of the mouth. This is when an individual is at rest, and of course, toned and suctioned when they're swallowing. Also, you'd be interested to know that when taking a drink, and you could try this for your own entertainment, when taking a drink, your tip of your tongue should still be behind your front teeth, and the drink of water or whatever you're drinking should wash over your front teeth and up through and into the tongue area. Then the swallowing pattern occurs. Most individuals are swallowing like pattern D. Okay, they're taking a drink with the tongue at the floor of the mouth. The liquid is rolling on past the tongue and just kind of trickling into the throat. The tongue doesn't get the exercise that it needs. Okay, so what does proper tongue position have to do with facial growth? Well, it says here that from a study that was done, that in fact, maximal oral facial growth takes place during the first 2 years of life. And by the age of 6, nearly 60% of the adult face has developed. Therefore, establishing adequate nasal breathing early in life is essential to maximize the growth of the skeletal complex and the upper airway. We're talking about the first and middle third of the airway here, okay? If the tongue is in the right position, the roof of the mouth develops properly. The roof of the mouth is the floor of the nasal cavity. The tongue is the body's natural expander, okay? If the tongue is strong and it's in the right position, then the middle third of the airway is not obstructed. The tongue is not falling back into the throat, into the nasopharyngeal airway, and blocking the airflow. So proper tongue position is essential, especially at an early age, for proper facial growth. As a healthcare practitioner, this is what you should be looking for. You should be looking to see how this child that you're seeing is developing. And if you see a child below the age of 6 that looks like they have a malocclusion, that looks like they're exhausted or tired, and we'll go over this in greater detail here in a minute, that should be an indicator for you to make a referral and to help this child get the treatment that they need. The tongue exerts up to 500 grams of pressure. It takes only 1.7 grams of lip pressure to move the anterior teeth. The lip exerts a force of 100 to 300 grams. So you could see where the lips could be a problem if they're not in proper function. An activated palatal expander can exert 200 to 600 grams of pressure. So what's the whole point of this? If the tongue is in the right place and the rest of the muscles are functioning as they should, and that's a training activity in most cases, then everything grows and develops as it should. The muscles will act as the body's natural orthodontic treatment. Does that mean that a child won't need orthodontic care? No, there might be something that needs to be done, but early intervention is key to getting the structures growing properly, and whatever orthodontic treatment they need, hopefully it would be a lot less and a lot less invasive. Again, here you can see is if the tongue is in the proper position on the roof of the mouth, it should grow to be a wide palate. If it is not, and it's down on the floor of the mouth, which is where we see 95% of our children's tongues resting, they grow into a narrow palate. Now the question is, what if the child already has that narrow palate and they didn't have early intervention, which we treat children from birth on up? So let's say we have a 7 or 8-year-old and their palate is narrow like this. They should definitely have palatal expansion to grow and expand their palate so we can get their tongue in the right position. If they do not retrain their tongue and they go through orthodontic therapy, it's very likely that they'll have orthodontic relapse, and some of those patterns are going to persist. The tongue properly positioned really has a lot to do with how the airway is managed. Proper tongue position aids in maintaining nasal breathing, which is essential for optimal oxygen intake and can affect sleep and overall health. If the tongue is in the roof of the mouth and the lips are parted, it is almost nearly impossible to breathe through the mouth. So having the tongue in the right position promotes nasal breathing. The position of the tongue directly affects the size of the airway. A properly positioned tongue can keep the airway open. So strategies for effective airway management, you're looking at a little kiddo and you notice some red flags. So what are the steps from there? Well, first, we have to understand, are there any obstructions, true obstructions, adenoids or tonsils? Those things need to be evaluated. If there are obstructions, we cannot, in the nasal cavity, we cannot retrain a child to breathe through their nose if they can't get air through their nose. Those obstructions need to be addressed. We have specific measures and tests to see if a child can breathe through their nose for a specific amount of time that they could go through our types of therapies. If they can't, then those obstructions need to be addressed. Of course, there's orthodontic intervention. If we don't have room in the roof of the mouth to get the tongue in the right position, we have to have an orthodontic evaluation so that the tongue can be in the right position once we train it to be there. The myofunctional therapy assists with that intervention, but also early on can develop the jaws properly so the tongue can get in the right position. And then obviously monitoring any sleep patterns if there are sleep studies available. Active myofunctional therapy for airway management, that is what we do here. Active myofunctional therapy is a more focused and intensive approach with a broader myofunctional framework. We focus on very customized exercises using our approved appliances. We increase patient involvement in a way that is something that they can replicate. With traditional myofunctional therapy exercises without appliances, it is very difficult to get a 3-year-old to do those exercises. Our appliances do those exercises for them naturally. and the children enjoy it. Active myofunctional therapy for airway management is goal-oriented. It's measured. We track their breathing patterns, their breath hold times, and their breathing function. We do that on a monthly basis, and the child and the families can track that at home as well. And we set goals for that. So every time we meet with the kids, we test them and see how far they have progressed to their goal. There are a lot of different techniques to be used for different problems, and having a therapist who can guide and target what needs to be treated and put together a program is really essential. Someone who knows what they're doing is essential to the success and the outcome of the myofunctional therapy treatment. At Airway Centers for Kids, we do use FDA-approved, patented, medical-grade, active myofunctional therapy appliances, making it easier for kiddos to be more compliant, which then is giving us the great results that we get. This is the unique and effective approach with the patented appliances that we use. This is just some of them. There are many more, but to give you an idea, we first work on the growth and development of the jaws and the airways and the breaking of any poor oral habits, such as tongue thrusting or mouth breathing. There's a series of appliances we go through for that, and then we use activity or exercise appliances that will strengthen all the rest of the muscles once we have established nasal breathing and broken any habits. These appliances are issued by the MRC company and have been around for, in some of these, over 30 years. So then why do you need to screen all patients and treat or refer the patients that you're seeing? If you're a dentist, the ADA made a statement in 2018 that the American Dental Association encourages dentists to screen patients for sleep-related breathing disorders as part of a comprehensive medical and dental history. This includes children. So you're going to screen, you're going to either refer or treat. And I can tell you, as a practicing general dentist for nearly 26 years, it's very difficult to treat children with myofunctional, even adults, with myofunctional therapy in a dental office setting. There's just too much going on, and the dentist has too many different procedures happening at the same time. And that is why a myofunctional therapy focused center should be considered. Getting the consent and educating and getting the consent of the parent as to what the problem is and why the problem needs to be treated, and reevaluating that from time to time to see if they've made any progress on getting the treatments underway. Also, as a note here, by referral, if you suspect that a child has a sleep-related breathing disorder, if you're examining the tonsils and you see a full obstruction there, a referral to a ear, nose, and throat specialist would be in order as well. If we see that, that's our first referral as well. So the things that you should be looking for, there are many things. There is a sleep questionnaire, because a lot of these things are showing up when a patient is sleeping, also while they're awake. So there's a series of questions that you can ask. But as a busy practitioner, here are the top 5 things that you should be looking for. And if you have a yes to any of these, you should definitely be making an evaluation or a referral for some type of assisted therapy, either orthodontics or myofunctional therapy or an ENT. Snoring, even if it's just a little bit, that's an indicator that something's not functioning properly. Any signs or symptoms or concerns of ADHD from the parent or a recent diagnosis should be an indicator. Teeth crowding, grinding, or any type of bite issues, that is an indicator as well. I know in dental school I was told that when a child grinds their teeth, it's normal, it's natural, they're just growing. It's kind of like growing pains. Actually, that's not true. A child grinding their teeth is a child that's trying to grow and establish their airway properly. Mouth breathing, when awake or when asleep, is a red flag. Number one culprit for poor muscle function and underdeveloped jaws and airways. That requires a discussion and referral and treatment. Enlarged adenoids and tonsils. That's also something to look for. And that should generate some type of conversation and path towards treatment. We do accept referrals. We work with a lot of kids from birth on up. We do have referral programs and different types of accessories to help you make your referral, such as a prescription, a flyer, and we also have a referral guide. If anyone who's watching this is interested in any of that information, we're happy to provide it to you. You would just email us at info@myofunctional.com and we can get that package over to you digitally or physically, whichever way works for you. A lot of what I discussed today has a lot of science, study, and research backing it. You can go down the rabbit hole yourself and just look up medical journals on sleep-related and breathing disorders in children, jaw and airway development, open mouth posture, mouth breathing. You'll see that this is nothing new. This conversation has been going on for centuries, and the publications are there to prove it. It is a problem, it is a pandemic, and it is something that needs to be treated. I recommend these 3 books for reading if you're interested in learning more and being able to have conversations with your patients as to why this is going on and how it's going on and what steps and measures parents can do to stop or prevent it from occurring. Shut Your Mouth and Save Your Life is a book that was written in the early 1800s. A retired lawyer wanted to paint Native Americans in their natural environment. And so he did that. And during that process, he realized that Native Americans focused heavily on nasal breathing over mouth breathing, and in fact, frowned heavily upon mouth breathing. And he noticed that those individuals, those Native Americans that were breathing through their nose, not their mouth, were growing healthy, strong. They didn't have dental problems. They didn't have crowded teeth. They had great societal structure, and he went down that rabbit hole. This book describes that and describes it really well. It's a very interesting and an easy read, and it's very enlightening. Nutrition and Physical Degeneration was written by a dentist. It's a pretty thick, heavy book, and it goes through all the different situations that are contributing to our physical degeneration and the degeneration of our nutrition and how that's impacting the growth and development of our facial structures and other structures as well. And then last but not least, JAWS is a pretty easy read. It's the story of a hidden epidemic, which I like to say is right under our noses, which is really mouth breathing and the underdevelopment of our jaws and our airways. Any of those 3 books or all of them, I highly recommend. That ends our webinar for today. I want to thank you very much for being here and participating in this, being proactive and bringing this situation to the attention of your patients and getting them on the right track to getting them the help they need is essential and actually your duty as a healthcare provider. So please be on the lookout for it. Please let us know if there's any way we can assist. And again, thank you very much for being here. If any of the information you would like to have sent to you, you can email us at info@myofunctional.com or just reach out through the contact center of our webpage at myofunctional.com. Thank you again. Have a great day.